Since the outbreak of the COVID-19 in the country, a number of efforts have been undertaken by local governments and the health sector to contain the spread of the disease. Given the limited resources, the government made a number of pledges to support interventions towards fighting the virus. Now, Parliament's Committee on Government Assurances has embarked on a countrywide follow-up exercise to confirm whether these pledges have been fulfilled.
The Prime Minister in front of us in Parliament talked of intensive care units to be given to every regional referral hospital, 10 in number. Have you got them? Money to different groups of people, ambulances. Of course, the amounts of money are here. We passed supplementary budget.
The DHO to also help us clarify on that special funding given to take care of those frontliners in his department, like the drivers.
In Gulu district, although many of the pledges were fulfilled, the legislators were left wondering why a number of key promises made by President Museveni still remain unfulfilled.
Yes, we got an ambulance, but I think that ambulance still belongs to Ministry of Health. Unfortunately, it broke down.
We don't have ICU. And yet with these new diseases coming up, we really need to work on this to have it here in this unit.
Apart from the ambulances, the 10 vehicles per district.
No.
Not
11.
The MPs also shared some shocking discoveries from the other districts in regards to management of funding towards the fight against the coronavirus.
We have also got complaints from drivers who are not getting their allowances from the beginning of the fight against COVID-19 to date. Some of them have not got even 10,000 shillings. So we want also to hear from that perspective how they're handling it here.
That, for example, we enter here, we saw people washing hands there and also check with the temperature guns. And unfortunately, in some hospitals that we have visited, or some places we have gone through, the allowances given for the health workers in the hospital or in the health facility are not given to those people, and yet they are part of the team.
Gulu's acting district health officer, Yoweri Idiba, refuted the allegations.
No driver is claiming that he has not got money. If he's there, let him come out and say which driver is that. But every driver has got money, and they got uniform money.
Meanwhile, there have been concerns over continued stigmatization against frontline health workers by members of the community. According to Dr. Pascal Apio, the assistant director of the hospital, for over 3 months now, the health workers have not visited their homes for fear of putting their families at risk, and yet many continue to undergo increasing stigmatization from the community.
Messages coming from other people who are not here. We thought they would die. Now corona does not kill. Those are not good messages to you who take care of this patient.
She notes that the situation has been challenging even for some of the discharge cases.
There's been rejection, and some of the family members, communities, to the extent of threatening to kill people we have discharged.
Nelson Omoya, NTV.
The results for those who are new to